Hi, and welcome to the Communities in Humanitarian Settings COVID-19 microtrainings. My name is Daniela Turbridge, and in this session, we'll be covering why the microtrainings have taken a community-centered approach that will be highlighted throughout the modules. These modules were created with an explicit focus on the communities we work in humanitarian settings and how they're affected by COVID-19, but also with the critical understanding that actions at the local level contribute to containment and mitigation of COVID-19 at a larger scale in the country and in the region, and lead to an overall more successful humanitarian response. Community level successes are the building blocks of humanitarian responses, and this is especially true during an infectious disease outbreak and right now during the COVID-19 pandemic. If we can successfully contain or reduce the transmission of COVID-19 at community level, we can ensure a multitude of positive ripple effects on other community activities. And this supports the possibility of being able to continue life-saving humanitarian activities. We also focus on community level activities, recognizing that each activity has an effect on others in the same locality because they're interlinked. The way in which community activities are carried out have direct effects on the spread of COVID-19. So how we design and carry out activities at community level is interlinked with the overall health of the communities we work in. For example, if food assistance is delivered in a safe way following COVID-19 mitigation guidelines and are, for example, switched to less distributions with more items per distribution, it reduces the risk of COVID-19 transmission. If transmission is reduced in a community, this in turn can mean the community health workers or WASH teams can carry out their essential services out more safely, and they can continue to carry out their essential role in maintaining and improving the health and well-being of the community. We also focus on community level activities given what we know about COVID-19 and how it spread, and what resources we have available to us to combat its spread. Community mitigation and control activities are the critical weapon to control and avoid the spread of COVID-19. Because everyone is susceptible to becoming sick, we have to use an approach that involves the whole community to be successful. As we go through the materials and examples, we'll point out how every community is different, and these unique differences change the way we carry out activities and changes the dynamics of how COVID-19 is spread. We focus on community level activities because these adaptations start locally, tailored to the needs of each unique context and the level of transmission present in their context, to ultimately minimize risk, mortality, and any secondary economic, social, and health effects of COVID-19. Any design and adaptations of humanitarian programming should keep communities at the center. As organizations move to adapt programming, enhance staff safeguarding, integrate social behavior change and risk communication and community engagement, and adapt to new coordination mechanisms, technical and operational guidelines are beginning to emerge. We aim to address identified gaps through the development of these micro trainings and a package focusing on community level activities for humanitarian NGO managers and staff with diverse operational and technical skill sets. The micro trainings will focus on the challenges related to community transmission and community prevention and treatment of COVID-19, and the complementarity and integration of activities among different sectors, which are considered essential for success. We will focus on community health programming, CHP, water, sanitation, and hygiene, and infection prevention and control, WASH and IPC, as well as the essential cross-cutting issue of risk communication and community engagement, RCCE. As we learn key considerations for community-level NGO activities, we encourage you to think of all the stakeholders that form a part of your community and all of the different groups that are impacted by your programming, and in turn, how their activities affect you and your programming. When we design programs, we often go through the process of doing a stakeholder analysis, and when redesigning programs, it's important to look at what additional stakeholders are relevant and how they interact with communities. This may mean new health NGOs responding to COVID-19, or a new WASH-focused NGO that's come to your area to increase clean water resources or support with hygiene messaging. If the community you work in has a particularly large outbreak, this may mean additional oversight by government authorities as well. Throughout the micro trainings, we focus on the stakeholders: humanitarian programming, community resources and activities, and local institutions as the fabric that has to work together to continue to support the community. We have to consider what resources and activities are ongoing somewhere to look at the role in mitigating and controlling spread and what impact that has on humanitarian programming, and vice versa, what the effects of changes in humanitarian programming may have an impact on other community activities and resources. There are many different factors to consider when planning and adapting humanitarian activities to address COVID-19 and to adapt existing programming to be COVID-19 sensitive in the community in humanitarian settings that we work in. The stakeholders and resources we outlined is one factor that you have to consider when adapting your programming. As always, we look to contextualize programming considering the unique characteristics of that community. This includes the geography, sources of livelihoods for community members, migratory patterns or new migratory events, religious practices, the social and ethnic makeup of the people, and more. You also have to consider the most recent government regulation or WHO guidelines that may enable or limit some activities in your context. This will change location to location. Throughout this training, we'll also be organizing the actions we have to take to adapt programming by different levels of action. Those carried out at the individual level, at community level, and considering the structural level. This will be covered more in the RCCE module. Humanitarian programming and community level activities are also heavily influenced by the level of COVID-19 transmission in the community you're working in, as well as transmission in the district or state that they're in and how much transmission there is in the country overall. It's very important that we plan, adapt, and implement activities according to the level of transmission in your community. To do so, we can use the WHO interim guidance, which outlines different transmission scenarios and has some key guides on appropriate action. Each one of these transmission scenarios has an effect on what activities are conducted with the goal to prevent or control the spread of COVID-19. Here we only outline what general mitigation activities have to be undertaken in each scenario, and we'll be using these to help us think through how being in different scenarios affects activities in WASH, community health programming, and risk communication and community engagement. We'll also use the scenarios to plan and adapt key community activities in the application session, which includes your own activities and challenges. Let's go briefly through the scenarios one by one. The first transmission scenario that you see at the top is that there are no reported cases, and the aim is to prevent spread if a case was reported. In the column level of mitigation on the right, you can see that it has specific planning and prevention activities if you're in that scenario. The next transmission scenario on the bottom is that there are sporadic or few cases introduced into the community. And this also has different mitigation activities to the previous scenario and has knock-on effects on humanitarian programming. If the community has more cases locally where the spread of the virus from person to person in a given context is observed, then the community would be in the third transmission scenario where there are clusters of cases. Finally, if there are outbreaks where there is no clear relationship to a particular event or a chain of transmission that's evident in the community, this is called the community transmission scenario that you can see at the bottom. This is a scenario that requires the strictest action to contain the spread of COVID-19 and to prevent mortality among members. We encourage that you take a look at the table and the interim guidance from WHO for more information, and that you use the transmission scenarios in your planning, because although you may be in the first or second transmission scenario today, that may change. This is an example to show you what these different scenarios could look like in terms of the number of cases over time. You may have seen a graph like this for your community or your state, or even at national level as the pandemic has progressed. In your context, it's likely that the government has set different scenarios that are specific to where you live. It's important to know in what scenario you're in, because as we showed you in the previous table, you have to take different actions as the pandemic progresses and depending on what transmission scenario you're in. Using the transmission scenarios, reassessing your context and the stakeholders in light of COVID-19, and starting the necessary community-based mitigation activities or adapting existing activities will help you ensure that your programming is COVID-19 sensitive. The level of adaptation will be unique to your context and unique to COVID-19, although it may be similar to other participants given the characteristics of the community you're working in and the resources that are available to all of you. By focusing on the community, adapting programming to being COVID-19 sensitive according to transmission phases, planning new and existing activities with the community stakeholders and with their specific local resources in mind, and giving special attention to key activities in WASH and IPC, community health programming, and RCCE, we will be able to meet the learning objectives for this training. All of the content in this micro training, including the live application session, will help you to adapt and strengthen your COVID-19 response plans. Now you've gone through the two introductory presentations, we invite you to start going through the foundational material and look forward to working with you during the application piece. Thank you.